Welcome back to InMedbay, and today's video is how to make the most out of placement. So you might be going from your preclinical years to your clinical years and wondering, how do I learn a lot on placement? What's placement like? And so today's video, I'm just going to give you a few tips on how to make the most of it. Tip number 1 is know your examinations. You need to know them really well so that you can bang out the steps easily. It's really important to know your examinations, especially cardio, GI and rest, because these ones are used so much and doctors will often ask you to perform these on patients. From my experience, doing examinations and taking history is the way I've learned the most. Make sure you try and get doctors to watch you do your examinations so that you improve your technique. Another little tip is make sure you learn your cranial nerve examinations, peripheral nerves, so upper limb and lower limb, for your A&E block. You're going to see a lot of patients that have had falls or strokes, and those examinations are the best ones for those. So it's a good idea to revise those ones before you start that block. Tip number 2 is know your skills as well. So these include all of the practical skills that they may have been teaching you in your preclinical years. For example, venipuncture, basic obs, cannula, all of that. You need to know them well enough so that you can perform them on a patient. Don't worry if you're not that confident in them, because you can always ask a nurse or a doctor to go through the steps with you to watch you do it, or you can just ask them, can I watch you do this one first and then I can do the next one. That way you don't have to worry about harming the patient or messing up the skill. Tip number 3 is places where you can go when you're bored. So sometimes when you're on a ward it can get a little bit dull and the person that you're paired with might be just doing more paperwork, menial tasks that there isn't much benefit of you following around. So what you can do is go to some other places in the hospital and maybe get more out of it. Our top tips are going to the cath lab, where they do day procedures such as changing pacemakers, and normally before they do these procedures they put a cannula on, so it's a good chance, an opportunity to get your cannulas in. Another good place to go see is the phlebotomist. This person will go around the wards and take bloods from potentially more difficult patients, but it's always good practice and you can really get good at that skill. Another place where you can go if you don't have anything else to do is the library. The library will offer books that you can read up on that might link to what you're learning on placement, and you can even just do some revision for your exams while you're there. The final one that we came up was the triage room in A&E. That's really good as well. You get lots of opportunities to do ECGs there and bloods, and you can befriend a nurse and she'll help you get lots of stuff signed off. Tip number 4. So tip number 4 is carry the Oxford Clinical Handbook with you. Or if you don't want to carry it around, you can always have a copy on your phone downloaded. This way, if you don't get something or you want to know the treatment for something, the management, the tests for a specific condition, you can easily get them up on your phone. And that's a good way to revise while you're on placement as well. Okay, my next tip is tip number 5, and that is prior to the block or the week that you're working in, do some revision that's relevant. So say if you're going to be on a respiratory ward for 1 week, it'd be good to go over some respiratory conditions so that you know what you're going to see and you know what to look out for. A tip that links to the previous tip, say if you want to hear crackles or you want to hear specific types of murmurs and you know you're going to go onto a cardiac ward or a rest ward, you can ask the doctor when you get there, are there any patients that have a ejection systolic murmur? And that way you'll get to build up a bank of different sounds that you need to hear on auscultation. Tip number 7, if you're feeling ignored on a ward round and you're getting bored, try and be more active in the ward round. Why don't you go and read the obs chart out to the doctor? That will be really helpful, and then you can go on and use that as a leading way to ask the consultant questions about the patient's condition and learn more. Moreover, you could also, while on the ward round, offer to try and make the notes on the continuation sheets. That way you can practice your F1 job, which we will be doing very soon. Okay, tip number 8, our final tip, is be prepared, and that means doing a checklist before you go to placement of things that you want to get done, to making sure you meal prep the night before so that you have a nice lunch to look forward to in the middle of the day, and make sure you have a big breakfast. All of these things are going to make you feel more positive, more ready to take on learning opportunities, which is what you need if you want to be motivated to get things done on placement. Being prepared also may involve emailing your GP placement before you get there, things that you want to get signed off and done, and that way they can organise it all for you, ready for when you get there. I hope you enjoyed that short, quick video of 8 tips on how to get the most out of placement. Please comment, like and subscribe to our channel so that we can keep posting more lifestyle and educational content for you guys. And that's all from us in InMedbay.